Welcome to Digimasters Shorts. We are your hosts, Adam Nagus
and Carly Wilson, delivering the latest scoop from the digital realm.
Google has released Gemini 3.1 Pro, its latest core reasoning model, marking another rapid step forward in the AI race. The company says the new model delivered twice the verified performance of its predecessor on the ARC AGI2 benchmark, a key test of logical reasoning. Gemini 3.1 Pro now powers the Gemini app and several of Google's AI tools, including DeepThink, and is designed to produce more creative and sophisticated solutions. In a company blog post, Google said the model is built for challenges that require advanced reasoning, data synthesis, and clear explanations of complex topics. The rollout begins immediately across the Gemini app, the Gemini API, and Notebook LM, with free users receiving limited access and paid subscribers granted higher usage caps. Enterprise customers and developers can also access the model through platforms such as Vertex AI, Gemini Enterprise, and Android Studio. The release underscores the intensifying competition among AI developers as new models are introduced at a rapid pace. When Gemini 3 Pro launched in November, it reportedly disrupted the competitive landscape and climbed to the top of major AI leaderboards. Google claims Gemini 3.1 Pro outperforms earlier Gemini models as well as offerings from Anthropic and OpenAI, including GPT 5.2. However, OpenAI's specialized coding model, GPT 5.3 Codex, surpassed Gemini 3.1 Pro on at least one verified software engineering benchmark.
Accenture is no longer simply encouraging employees to embrace artificial intelligence. The consulting giant has informed senior staff that regular use of its internal AI tools will now factor into promotion decisions, according to a report confirmed by the company. Accenture says it has begun tracking weekly logins to its AI systems, though it has not clarified how much usage is required to stay promotion eligible. The move signals a tougher stance on adoption as the firm pushes deeper into AI integration. This is not the first warning shot. Back in September, Accenture told employees they would need to reskill in artificial intelligence or risk losing their jobs. Despite mounting pressure from corporate leaders, broader adoption across the workforce remains uneven. A recent study by Google and Ipsos found that only about 2 in 5 US employees use AI at work, even casually. Accenture's new policy underscores how central AI has become to its strategy and how quickly optional experimentation is turning into mandatory participation. Mind has launched a year-long inquiry into artificial intelligence and mental health after an investigation found Google's AI overviews delivered what experts called very dangerous medical advice. The charity, which operates in England and Wales, said the Commission will examine the risks and safeguards needed as AI becomes more embedded in everyday life. The move follows revelations that AI-generated summaries displayed to billions of users each month contained false and misleading health information. Some responses relating to psychosis and eating disorders were described as incorrect, harmful, and potentially capable of deterring people from seeking professional help. Mind's chief executive, Dr. Sarah Hughes, warned that dangerously incorrect guidance could reinforce stigma, prevent treatment, and in the worst cases put lives at risk. She said AI has the potential to improve access to mental health support, but only if developed with regulation and protections proportionate to the risks. The Commission, described as the first of its kind globally, will bring together clinicians, policymakers, technology firms, and people with lived experience. It aims to shape stronger standards and create what Mind calls a safer digital mental health ecosystem. Google has defended its AI overviews as helpful and reliable, saying it invests heavily in quality and provides crisis hotline information when users appear distressed. However, critics argue the technology replaces nuanced, source-based health information with confident-sounding summaries that may give a misleading sense of certainty.
The Food and Drug Administration has appointed Rick Abramson, a former executive at a health artificial intelligence company, to lead its Digital Health Center of Excellence. Abramson previously served as Chief Medical Officer at a subsidiary of Harrison AI, a firm that develops AI tools to interpret radiological images. His selection comes as the agency navigates complex decisions about how to regulate artificial intelligence in medicine. Abramson has been working as a senior advisor in the FDA Commissioner's Office since last summer. In January, the agency announced plans to soften oversight of certain AI products that support clinical decision-making. The changes would also allow more low-risk wellness products to bypass formal FDA review. According to 3 agency employees, Abramson played a key role in the push to deregulate some AI technologies, alongside other senior officials in the Commissioner's Office. His new leadership position places him at the center of the FDA's evolving digital health strategy. The appointment signals a potentially more flexible regulatory approach as AI tools become increasingly embedded in patient care.
Thank you for listening to today's AI and Tech News Podcast summary. Please do leave us a comment, and for additional feedback, please email us at podcast@digimasters.co.uk. You can now follow us on Instagram and Threads by searching for @Digimaster Shorts or search for Digimasters on LinkedIn. Be sure to tune in tomorrow, and don't forget to follow or subscribe.